The global pandemic has changed the world in unprecedented ways. At the Women's Refugee Commission, we witnessed how especially challenging this year has been for women, children and youth displaced by conflict and crisis. But we saw something else too: resilient, skilled and courageous refugees working together and with our partners to transform their lives. Despite the changes in how we work, WRC continued to research refugees' needs, identify solutions, and advocate for programs and policies to bolster support for this extraordinary community. It is our honor to share the stories of 3 of the programs WRC is proud to work with, programs that strive every day to make the world a better place for refugees. Cash transfers, which are widely used in development settings, can help create economic choice and contribute to the dignity of displaced people. But the humanitarian community has been slow to adopt this form of assistance. In Ecuador, WRC supported CARE in developing a successful pilot program that uses cash transfers, a program that not only works, but that works for survivors of gender-based violence.
CARE's program addresses the needs of most vulnerable people. Gender-based violence is growing and is pervasive, and it affects not only migrants and refugees, but also host communities. The collaboration between CARE and WRC was very positive. We were able to develop several activities. The most important, to provide assistance to gender-based violence survivors with local partner organizations, and also to learn and document this process through briefing and research documents that are useful for other organizations to replicate this positive experience. What I have learned and surprised me in my work is the incredible resilience of migrants, refugees, LGBT people, survivors of gender-based violence that are able to stand up in their feet and continue seeking to improve their lives.
CARE Ecuador's pilot program was a success, and now WRC is looking forward to continuing our partnership, advocating for and scaling the cash voucher assistance program in Ecuador and beyond. Malaysian law denies women the right to pass on citizenship to their foreign-born children. WRC's work with the Malaysian Campaign for Equal Citizenship has resulted in strong calls for Malaysia to change its citizenship laws. Bina Ramanand, a member of the Global Campaign for Equal Nationality Rights, which is housed at WRC, works with Family Frontiers to coordinate this effort.
Malaysia is one of 25 countries that denies women the right to pass on citizenship to their children born overseas, and these women are treated as second-class citizens. A non-citizen child has to get a visa every 6 months. They have difficulty accessing public school education, accessing affordable health care. So the support that has been provided by WRC has helped to raise the awareness with the policymakers, the public, and also get more mothers in touch with us. WRC provided us with the support to connect with other organizations who had similar issues. So we kind of shared best practices. There's an urgent need for women to be empowered. That will come only when women are treated equally.
In Borno State, Nigeria, many women and children do not have access to comprehensive health care. In partnership with the Muada Ghana Foundation and others, the Women's Refugee Commission supports the Borno State Primary Healthcare Development Agency to increase access to reproductive and child health care and nutrition services. The project is anchored by the Village Health Workers Program, a cadre of trained workers who conduct guided home health visits in their communities. The project emphasizes government leadership and local capacity strengthening at every level in order to achieve long-term sustainability.
Muada Ghana Foundation, when WRC came, was a very, very young organization. Through the partnership, Mother Ghana Foundation has been able to build its skills in terms of program implementation and also curriculum development. WRC had been like our mentor, if I may say. We went to the community and found women that would normally be at home doing nothing. But now here they are. They are the champions of the Village Health Worker program, going into the homes with the simple flip charts we've developed. And they're able to carry health promotion, health education, refer women and children and adolescents to health facilities if they need. The women were really empowered.
These partnerships bring to life WRC's vision, a world in which internally displaced and refugee women, children, and youth are safe, healthy, and self-reliant, where their human rights are respected and protected, and where refugees inform and drive solutions. Join us. Your support helps make our vision a reality. To learn more, please visit womensrefugeecommission.org.